Hi, my name is Dr. Greg Doerr. I practice in New Jersey, and what we're going to be demonstrating today is some taping techniques for myofascial back pain. Now, the most important part of actually determining what kind of a tape job you want to use is determining what's wrong with the patient. So in this particular case, we noticed we had a patient who had pain a bit on flexion. When he comes forward, he gets a little bit of centralized low back pain, and then also with extension. Now, on all the other motions we've already tested them, they really weren't that bad. So in particular, there's two major things we want to look at associated with this kind of motion-oriented back pain. Number one, how much of it is just muscle-oriented, and some of it may also have a little bit of a mechanics-oriented problem to go with it. Now, an easy way of determining which way we actually want to tape the person, using something like a straight kinesiology taping technique versus using some leukotape with kinesiology tape and using a tab-oriented tape job, which we'll explain in a second, it's largely about the evaluation procedure. So in particular, if we're just going to be using something like kinesiotape on somebody, the patient can tell us, I have pain going into lumbar flexion. And the easiest way of determining was whether or not a straight kinesiology taping technique is going to be most effective is simply by doing a soft tissue procedure associated with his movement pain. So in particular, what we're going to do with our patient, just to start with, we can do this with instruments, or we can do this with our hands. In particular right now, just because I don't have my instruments on me, I'm just going to start with hands. And what we're going to have the patient do is, I'm just going to brace him. And what I want him to do is just start moving into flexion for me. Good, come on back. And again. Good, come on back. We're just going to do like 3, 4 of these in a row, and we're going to go to the other side. Come on back. Good, one more time. Good. And we can go to the other side now, same exact thing. Good. Two more times. Last one. Okay, now, ideally what we're looking for when we've done a little bit of this soft tissue treatment is we want to see a minimum of a 50% reduction in symptoms on the symptomatic movement. So we just did this for flexion. So we're going to just have him go back into flexion again. And we're looking, if it was a 10 the first time he did it, is it a 5 or lower? Yeah, okay. Yeah. So if he's actually reduced that much, and we've gone to about a 50% reduction or more, we can do a straight neurologic tape job right over the same area we did our soft tissue. The reason why this actually works is the same nerve receptors that we stimulate in the skin associated with a soft tissue treatment that improved his symptoms. It's like hitting Control-Alt-Delete on a frozen computer. It just reboots the system. The tape will actually stimulate the same exact receptors that you do during a soft tissue treatment. So taping for me is a way of treating the patient when they leave my office. It's going to keep stimulating the same receptors that created that neurologic reset that keeps him pain-free or gives him increased function before pain will start. So the tape job for that is relatively simple. All we're going to do is have the patient turn. I'm going to measure this over his clothing. So what I've done here is I've measured one side of the back, but we're going to do both. And all I'm going to do is fold that tape in half, make one cut to have the two same size, and then since this is obviously for a clinical purpose, we can fold the tape a half again and round our edges. And now we have two individual cuts. So we're going to break a base where we're going to start by affixing the tape to his low back. So we'll lift up his shirt. And what I'm going to have him do is I just want him to put a little tension on the skin. So we're going to have him lean forward a little bit, try and round the back. And we'll start by putting some tape right at the base of the sacrum. And all we're doing is coming straight up. You'll see that I put my finger right behind the tape as I'm peeling it off. It keeps it smooth, no wrinkles. And now I'll just peel off the rest of the backing, that last 10%. We'll always rub the tape because it activates the adhesive and have it stick to the skin. When we get to the corners, it's always good to use the backing to rub because of the wax on the back. It won't catch the tape and peel it back off. We're going to do the same exact thing on the right side.
This is the movement, right? It's here.
And now we basically have a lumbar taping for myofascial pain associated with what would be more of a neurosensory application. In other words, stimulation of the receptors on the skin that were improved during a soft tissue treatment. Now, the other way we can look at this is a little bit more of that mechanical. Now, granted, it's still a neurologic stimulation, but looking at it more from a mechanic standpoint. Now, in particular, our patient also had pain going into extension. So in this situation, we're just going to have him lean back again and determine if he's still got his pain and extension. Okay. So he still has pain and extension even though the flexion had gotten better. What we want to look at in this case is his pelvis. Now, we could do soft tissue treatments over the hip flexors and the glutes, which also tends to help a lot of extension pain. But in this situation, we've actually done some pre-evaluation on him and determined that forced closures in the sacroiliac joint actually make him feel better. So in this particular case, it was correcting for a left posterior ilium, which is then also correcting for a right anterior ilium because of the counterbalance. And what we're going to do is a standing forced closure and then have him reproduce his extension pain. And we're looking for, again, either a 50% reduction in pain as he goes into extension, or his range of motion increases drastically before the pain comes on. So in that situation, once again, the forced closure is basically just taking my hand right up onto the PSIS, my right hand onto the ASIS, and I'm going to give a squeeze and he's going to lean back again. And once again, what we're looking for, again, if it was a 10 before, have we gone to a 5? Yeah. So when we have that 50% reduction again, we know that the tape job will be effective. And in this particular case, we're going to have him just move over just a little bit here. And if you can just use the table and just lean on that for a second. Now, what we're going to do with this one, we can again use our kinesiology tape. And this is going to be a correction for a left posterior ilium. So we're going to measure from sacrum to lateral lumbar, and we're going to cut 2 strips of tape for this. Once again, we fold it in half, cut the 2 edges. Now, it doesn't matter which side you start on. We're just going to bring back his pants just a little bit to get his sacrum exposed. We'll start right on that left side. And all we're doing is just peeling off the tape at paper off tension. Now, this is what we're doing with the leukotape. We're actually going to do what's called a AC tab, or an approximation compression tab. This is a technique that was developed by Dr. Tim Brown in California. And we're going to make it a tab. Now, this tab is going to mimic the forced closure. In other words, we're going to pull the tissue into the direction that we were trying to correct the mechanics. We're going to place our finger just in front of that tab, about a 1/4 inch. And now we're going to pull the tab right over our finger. And you're going to see a little convolution that develops right on the skin. We'll put our second strip down. I always try and cover the edges of the first strip. And now this was the anterior side. So we're going to place our tab down, except this time instead of pulling from back to front, we're pulling from front to back. Once again, catching that tab. We're just going to move that down just a little bit. Finger in front, pull directly over. And from here, we can have our patient redo their extension again, and that should, again, create our 50% reduction or more in pain as he goes into extension. Or you can see, as in this case, he goes back significantly more. Okay? So these are 2 simple tape jobs that we can use using 2 different types of applications. Neurosensory, once again, the easiest way of determining that a neurosensory tape job, just kinesio tape over an area, is going to be effective is by doing a soft tissue treatment over the area of the soft tissue that is provoked, whether it's through a manual muscle test or a simple range of motion. The second tape job we did was, again, a neurosensory style, but using an SPRT tab, an AC tab, and that was done using manual forced closures, or that could be done by simply pulling on the skin in a certain direction that we notice creates that 50% reduction either through the range of motion or through a muscle test or a functional activity. So here are 2 examples of different concepts that we can use for creating an improvement in myofascial pain in the low back.